Hello and welcome. Today, we're diving into the intricacies of hereditary pancreatitis, a rare genetic disorder that can significantly impact the digestive system. We'll explore its causes, how it affects the body, the signs to look for, and what can be done to manage this condition. Hereditary pancreatitis, as the name suggests, is primarily caused by genetic mutations. These mutations typically occur in genes responsible for producing proteins that regulate the activity of digestive enzymes within the pancreas. The most common gene involved is the PRSS1 gene, which encodes for cationic trypsinogen, a precursor to the enzyme trypsin. Other genes, such as SPIM1, CTRC, and CFTR, can also be implicated, albeit less frequently. These genetic flaws disrupt the delicate balance, leading to premature activation of digestive enzymes within the pancreas itself. Now let's talk about how hereditary pancreatitis actually unfolds within the body. Normally, trypsinogen is produced in the pancreas in an inactive form and is only activated in the small intestine, preventing self-digestion. However, in hereditary pancreatitis, the genetic mutations cause trypsinogen to become prematurely activated into trypsin while still inside the pancreas. This early activation triggers a cascade of events, activating other digestive enzymes and essentially causing the pancreas to begin digesting itself. This results in inflammation and damage to the pancreatic tissue, leading to recurrent episodes of acute pancreatitis and, eventually, chronic pancreatitis. Over time, this can lead to scarring, fibrosis, and loss of pancreatic function. Hereditary pancreatitis is a relatively rare condition. It's estimated to account for a small percentage of all pancreatitis cases. Due to its genetic nature, it often clusters within families, meaning that individuals with a family history of pancreatitis are at a higher risk. Because it is a genetic condition, it's found worldwide, but prevalence varies depending on the population and genetic screening practices. The signs and symptoms of hereditary pancreatitis are similar to other forms of pancreatitis. The hallmark symptom is abdominal pain, often severe and persistent. This pain can radiate to the back and may be worsened by eating. Other common symptoms include nausea, vomiting, fever, and weight loss. Over time, as the pancreas becomes increasingly damaged, individuals may develop signs of chronic pancreatitis, such as diabetes, malabsorption, difficulty absorbing nutrients, and steatorrhea, fatty stools. The onset of symptoms can vary, with some individuals experiencing their first episode in childhood, while others may not develop symptoms until adulthood. Diagnosing hereditary pancreatitis requires a thorough evaluation. The process typically begins with a review of the patient's medical history and a physical examination. Blood tests are essential to measure levels of pancreatic enzymes, such as amylase and lipase, which are often elevated during a pancreatitis attack. Imaging studies, such as CT scans and MRI scans, are used to visualize the pancreas and identify any structural abnormalities, inflammation, or damage. Genetic testing is crucial to confirm the diagnosis by identifying specific mutations in genes like PRS1, SPNK1, CTR, or CFTR. A family history of pancreatitis is a strong indicator, prompting further investigation. While there aren't distinct classifications or types of hereditary pancreatitis in the same way we might classify other diseases, it's important to note that the severity and progression of the condition can vary significantly from person to person. This variability can be influenced by the specific gene mutation involved, other genetic factors, environmental factors such as diet and alcohol consumption, and individual responses to treatment. Unfortunately, there's no cure for hereditary pancreatitis. Treatment focuses on managing the symptoms, preventing complications, and improving the patient's quality of life. Pain management is a crucial aspect of treatment, often involving pain medications and nerve blocks. Dietary modifications, such as a low-fat diet, are important to reduce pancreatic stimulation and prevent malabsorption. Enzyme replacement therapy can help improve digestion and nutrient absorption, especially if pancreatic function is impaired. In some cases, surgery may be necessary to relieve obstructions in the pancreatic duct or to remove damaged portions of the pancreas. Lifestyle modifications, such as avoiding alcohol and smoking, are essential. Because hereditary pancreatitis is a genetic condition, prevention in the traditional sense is not possible. However, genetic counseling is highly recommended for individuals with a family history of the disease. Genetic counseling can help assess the risk of inheriting the condition and provide information about genetic testing options. For individuals who carry a known mutation, lifestyle modifications, such as avoiding alcohol and maintaining a healthy diet, may help to reduce the frequency and severity of pancreatitis attacks. Early diagnosis and management are crucial to prevent long-term complications. The prognosis for individuals with hereditary pancreatitis can vary. While the condition is often chronic and requires ongoing management, many individuals can live relatively normal lives with appropriate treatment and lifestyle modifications. However, complications such as chronic pain, diabetes, and pancreatic cancer can significantly impact the prognosis. Recent research is focused on developing new therapies to prevent or slow the progression of the disease. This includes exploring gene therapy approaches to correct the underlying genetic defects and developing targeted therapies to reduce inflammation and prevent pancreatic damage. Researchers are also investigating the role of other genes and environmental factors in the development of hereditary pancreatitis. These advancements offer hope for improved outcomes and a better quality of life for individuals affected by this challenging condition.